Thank you for logging on to today's webinar, Professionals and Community Members as Recovery Allies. My name is Marla Kaufman, and I'm the Communication and Health Promotion Associate at IRETA. I will be moderating our webinar today. Please note that this webinar is a continuation of a webinar we had to reschedule from last week due to a power outage. Our presenter, Allison Jones-Webb, will do a review of content discussed last week and then finish the webinar from where we left off. If you missed the first part of the webinar, that recording will be available on our website, along with this recording within the next week. I would like to go over some quick housekeeping items about how to use the WebEx technology and how to access continuing education credits. First, we would like to encourage you all to participate in today's webinar via a few ways. If you have questions for our presenter or are experiencing any technical issues, please use either the chat function or the Q&A panel to communicate your questions. Our presenter, Allison Jones-Webb, will take questions at the end of the webinar. Feel free to submit your questions through the chat or Q&A box at any time. This webinar is approved for 1.5 PCB and/or NADAC credits, which are free. A certificate of attendance will also be available to download from your MyIRETA account. Please take note that it will take up to 48 hours for your CEUs and certificate to be available in your MyIRETA profile because we have to cross-check your attendance with WebEx following the webinar. After the webinar, you will receive a follow-up email. This email will include a link to an evaluation form for the webinar, as well as more information on how to access your certificate of attendance and continuing education credits. We may send you an additional email to remind you of the evaluation. I would like to now introduce today's presenter. Author and public health professional Allison Jones-Webb of Charlottesville, Virginia, is a passionate advocate for people in recovery from addictions. She has written extensively about issues related to recovery from addiction and harm reduction. Her book, Recovery Allies: How to Support Addiction Recovery and Build Recovery-Friendly Communities, lays out practical ways that communities can help support people in recovery and why this is so vitally important. Webb holds master's degrees in public health from the University of New England and in economic history from the Johns Hopkins University. She is a certified prevention specialist, trained recovery coach, recovery ambassador with Faces and Voices of Recovery, and a member of the Virginia Recovery Advocacy Project. She was a founding member of Maine's first chapter of Young People in Recovery and served on the steering committee to develop the University of Southern Maine's Collegiate Recovery Program. She is past president of the Maine Association of Recovery Residencies and an active volunteer in numerous other recovery-related efforts. Webb has more than 20 years of experience in public speaking, policy development and advocacy, data-driven decision-making, nonprofit strategic planning, community outreach and organizing, and linking community members with healthcare. Okay, Allison, if you are ready, I will hand things over to you.
That's great. Thank you so much, Marla. And thank you everyone who was on the webinar last week and is returning. I appreciate your persistence. And if you're new, thanks for coming. And I hope that if you want a little more background on what we talked about last week, to please go ahead and review that webinar, which will be posted. And in that webinar, also, there's a little bit more about myself. What I'm going to do today is do a super brief review of where what we talked about last time, and then I'll pick up where we left off. So we're talking today about professionals and community members as recovery allies. And partly that means professionals as allies, but then also it means professionals who are able to support community members who want to be allies as well. So the agenda was recovery allies. Who is a recovery ally, and can addiction professionals and other professionals be allies? The recovery ecosystem, why allies are important there. Recovery capital, how can recovery allies help build recovery capital? And then engaging recovery allies, what can allies do? And so we're pretty much ended the last time at the end of recovery capital. So I'm going to go over those first three bullets pretty quickly, and then we'll start with engaging recovery allies. What can you do? So there's not a real definition of ally in the literature. We talked a little bit about a recovery ally who is someone who is interested in learning, interested in introspection, and interested in willing to change as a way of supporting someone that they love or someone in the recovery community. And this definition is the one that I use. It focuses more on what allies can do. So, a recovery ally is someone who uses their resources and connections to support people in recovery and the recovery community. And sometimes I add to that connections to power. Some people are frustrated with this, not so much frustrated with the definition, but frustrated when I talk about what you can do. This definition basically tells you what to do. It says, look at your resources that you have, look at the connections that you have, and find your way of supporting people in recovery. Then we talked about the recovery ecosystem. There are a couple of different ways of looking at the ecosystem. One of them was um, a mapping of resources in the community for people in recovery that had to do with treatment and harm reduction, family courts, and so forth. Another definition had to do with the continuum of care, really more a healthcare provider view. And this one, the one that I use, is really more focused on the community with the individual in recovery in the center. And so the individual in recovery has relationships most closely with parents, children, siblings, spouses, partners. Further out, extended family and friends. Further out, not quite so close to that person, landlords, employers, financial institutions. This would where is where you all might be, social service providers or treatment providers. Further out, still further, business owners, local decision makers, researchers. Some of you may be in that category, colleges, universities. And then furthest out, state and federal decision makers, public funders, and private foundations. And we talked about the importance of the individuals who are close to the person in recovery, but perhaps those state and federal decision makers and funders have the potential to have the greatest impact on that person that's in recovery that they don't even know because of policy decisions that get made and funding decisions that get made. Then we talked about recovery capital. And for most of you, I'm sure this is a review. I just want to go over it to make sure we're on the same page. What's important about knowing about recovery capital is that individuals in the community don't necessarily know what it is. And in my experience, when we talk about recovery capital with people who are inclined to be supportive, a light bulb goes off and they understand, oh, okay, so I understand some of the things that are necessary in a person's life to live in recovery. So personal recovery capital are those things that belong to the individual or are a part of the individual. So housing is a very important aspect, basic needs, education, employment, those are the very important parts of recovery. And then decision-making skills, financial management skills, self-esteem, those are all part of the what the individual sort of owns. And then social recovery capital are social relationships. And so that ranges from family relationships to friend relationships to social relationships in the community, in the recovery community, but also in the broader community. And community recovery capital is basically what's available in the community to support individuals in recovery. And so that includes recovery support services. It includes a sense of trust in the community. It includes the attitudes that we have in the community towards recovery, as well as specifically recovery focused issues. So here's where I'm going to start with the content, with the new content, perhaps. So David Best, Dr. David Best, is a recovery researcher who, as far as I can tell, knows just about everything about recovery that there is to know. He's very good at making sort of distilling research into very understandable little nuggets. And what he says here, how do people get better? He says, they change their social networks and they engage in meaningful activities. Now, that's the research. The research shows the importance of new social networks, usually social networks of people who are not using substances, but certainly new social networks, new friends, extended family who are kind of brought in to a person's circle, and they engage in meaningful activities. Most often, that means employment, also means education. And one of the things that's very important in the recovery community are volunteering and giving back. So, if you're a community member and you understand that these are the research shows these are the two big ones for people getting better and staying better, staying well, then you can figure out how to help people change social networks, and you can figure out how to be a part of meaningful activities that includes people in recovery. So I have some specific actions for allies. These are for you, but again, they're also if you're engaging with people in the community, for example, family members and or friends that are curious about how they can be supportive. These are actions for allies. So the first one is to learn about addiction and recovery. Second one is fight discrimination, prejudice, and stigma. The third is to know about resources in your area and also online resources. And then this last one, understand your place in the recovery ecosystem. Remember that orb, and then know where your sphere of influence is and where you are best suited to take action. So I'll go through those and give a little bit more detail. So learn about addiction and recovery. Um, so this again may be obvious to you all, but it's not obvious to community members. So don't stop learning. So if you learned about addiction and recovery 10 years ago or 15 years ago, I can tell you that the research landscape is very different now than it was then. And what we know about how people get well and how people stay well is very different than it was 10 or 15 years ago. So don't stop learning. Keep current on research, but also keep current with what people in the recovery community are saying about recovery, and appreciate different definitions of recovery. So the definition that I use is SAMHSA's definition. It's as good as any other definition. I'll talk about that in a second. So SAMHSA's definition is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. Now, SAMHSA spent a lot of time developing this definition. It is relevant for both recovery from substance use disorder and recovery from mental health issues. You notice that there's nothing in there about abstinence. It says nothing about substances. It's basically a definition of how it's a definition of how people can figure out their own path for getting better, and they can then be their best selves given any constraints that they face. So that recovery is going to look different for different people, and appreciating the different definitions that individuals have of their own recovery is particularly important. And then appreciating different pathways to recovery. So this is how people get in recovery. So we know it could be a disastrous event in a person's personal life and relationships. It could be an arrest, it could be incarceration, but it could also be an internal switch that gets thrown where a person has that realization like, wow, I got to do something different. So that's the pathway to recovery. And then pathways in recovery are what people do once they're there. And there's certainly lots of different pathways. The two that, of course, stand out the most, or the three, I suppose, are first of all, abstinence, which is what people often think about when they think about recovery from addiction. The second one is medications, taking medications for addiction. And usually we're talking about Suboxone and methadone, but there are also medications for alcohol use disorder. And the third one that we're often talking about is harm reduction, where people reduce their use, they reduce the harm, but they don't stop using altogether. So understanding how people get in recovery and how they stay in recovery according to their own definition of how they're living their best lives is really important for allies to do. And when you're learning about addiction and recovery, this is the website that I send everyone to. Where's the evidence? The Recovery Research Institute. And so this website has it's searchable, and it has a summary of hundreds, probably thousands of articles that have been written both on recovery and addiction. And It summarizes each one of them in a way that will make sense to family members. It will make sense to an individual who's either seeking or in recovery. It will make sense to treatment providers, healthcare providers, and researchers. So it lays out whatever category you find yourself in, you can look to that to understand what the research is telling us today. So allies fight discrimination, prejudice, and stigma. They really start with themselves in this category. They start thinking about their own experiences, either with using drugs and alcohol or their own experiences of people that they love who've used drugs and alcohol. And they reflect on that and they understand how that impacts the way they think about others who use substances or others who are in recovery. And once they kind of understand where they're coming from, they have a willingness to change their attitudes based on new information. So, if a person is used to thinking about people with alcohol use disorder as a bunch of drunks, because that is the experience in his family and that is what he learned growing up, when he learns new ways to think about it, he actually changes his attitude about it. So, that's thinking about your own experiences and being willing to change. Um, Being willing to change, figuring out how to be more empathetic. Okay, calling somebody a drunk isn't terribly empathetic. More accepting of the challenges that a person who was using and is now in recovery had and has. And then, particularly in terms of stigma, figuring out how you can speak up. So we know that language is important. I just use the definition of a drunk rather than a person who has a problem with alcohol or has an alcohol use disorder. Um, but when you hear things in the community that are stigmatizing, are negative, are labeling people in recovery in a way that they probably may not want to be labeled, figuring out how you can speak up. Now, that depends on the circumstances, it depends on the situation. But as allies, we need to be aware and ready to speak up when something occurs. So, allies know about resources in your area and online. The importance there is partly just to be educated about what the recovery support services look like in your area, to be kind of just a part of that world of recovery and treatment. But also, when somebody needs help, you're ready to go. Okay, if we're thinking about personal recovery capital resources and a person needs access to basic needs, housing, for example, you're ready to go and say, you know what, I know a little bit about housing and I think I can direct you to a landlord who's a friendly, recovery friendly landlord. Um, Similarly, social recovery capital, community recovery capital, we know about these things so that when we're engaged with people in recovery and there may be a gap in what they've got, we can help them out with that. Also, when we know about things, we know where the gaps are and we can be a part of a solution if, for example, there's a treatment gap in our community. As allies, we can be a part of figuring out how to fill that gap. And then understanding your sphere of influence in the recovery ecosystem. So, um, if we're going to help individuals, but also the community generally to build recovery capital, we need to know where we are. So, if we're an employer, our actions might be pretty different than if we're a city council person or a researcher or a teacher in a high school. And so, we need to understand where we are and what we're good at. If I'm a teacher, I'm going to be probably pretty good at speaking with parents. I'm going to be good at conveying information, connecting students to something that they may need outside of class. That could be my allyship. And so again, people kind of get a little frustrated when I don't just say, well, here's what you have to do. Really, being an ally is figuring out where you are, figuring out what your skills and talents are, and then figuring out your own best action after that. So, allies, ask yourself and then ask other allies, what are your personal and professional strengths? And in particular, research shows that these four pillars of recovery, these are four areas where people in recovery need to have a solid base in order to have a healthy recovery. So I'll talk about each of them: home, health, purpose, and community. So home can be where you live in your family environment. And so people in recovery often never leave their home. They may not even go out to treatment. They may be living at home, sort of trying to figure out how to heal and how to get better. And so allies within the family unit really can be helpful in changing the conversation, talking about hope, creating networks of people who are not using. If you have a son or a daughter who is in recovery, figuring out how to bring that person into a bigger family um, party, for example, or introducing them to new work opportunities. Looking for resources. Now, finding resources, including online, you can be helpful that way. But of course, it's pretty important for the individual in recovery to be looking for their own resources as well. Research is very clear about the importance of spouses and partners being supportive, and also the importance, particularly for women, living with their children, if they've lost custody of their children, getting their children back. And then, so family and friends, here we are creating meaningful activities anywhere in that recovery ecosystem. Home also, we can talk about safe recovery housing. So for individuals who can't go home, either it's not safe for them to go home, they don't want to go home, they don't happen to be living near their home when they enter recovery, recovery housing is often a good answer. And so there are lots of issues that come up around recovery housing. First of all, access to it. Some communities have lots and lots of recovery housing, others don't. Some recovery communities have a lot of recovery housing, which is certified, nationally certified by the National Alliance of Recovery Residences. Some communities just have houses where people show up and they're not certified. So a family member doesn't, and an individual seeking housing doesn't know what the quality is going to look like. And then, in each locality, without exception, honestly, there are challenges that zoning boards will bring up. There's NIMBY issues when people find out there's a recovery residence in their neighborhood. They often will reject it, and then landlords. So oftentimes, recovery houses, usually actually, recovery houses are rented from a landlord, and so educating landlords about the importance of recovery, what recovery is, what actually goes on in a recovery residence, which is not using drugs, but actually very healthy, building healthy relationships. Um, and I put in here access to naloxone. So recovery, I think this may be old news, that access to naloxone is one of the key ways that we support people in recovery from opioid use disorder, and certainly in recovery housing. And I think right now, the National Alliance of Recovery Residences requires for certification naloxone on each floor where people are sleeping. Then, recovery housing in a more regional way. So people need safe recovery housing, and it may not be a recovery house. It may be a rental unit. It may be they've gone through recovery housing and now they're transitioning to independent living. Again, they still need um, landlords that are understanding, and a lot of that happens at the regional level where there are housing coalitions who are working on the full continuum of housing. So resources for people who are unhoused, people who are at risk for losing their housing, people who want to live independently, and so forth. And then housing policies and funding at the provincial or national level. This is always an issue for housing generally, and then for people in recovery, it's a little bit, it's a particular, it's special, sort of like a special population. So your sphere of influence may be in the health um, sector. And so it's incumbent on you as a healthcare provider or as a treatment provider to really tackle stigma head on. And so, I think we have done a lot of work in this area where healthcare providers have become educated about addiction, have become educated about recovery, know a whole lot more than they used to. But I continue to have people tell me the treatment that they receive when they're in a healthcare setting uh, in recovery is that they are shamed about their either their past or they're shamed about their current use of medication for addiction. And so we have a lot to learn around stigma. Uh, we can do that through office trainings, discussions, leading by example. I always like to think about grand rounds where physicians usually are speaking to physicians. Peer-to-peer discussions are often the most helpful. If you hear somebody saying something that's just not going to be helpful for their patients or their clients, it's a good idea to figure out how to speak up. Healthcare providers can give recovery checkups. This is something that some patients in recovery ask for. Uh, Oftentimes, people do not discuss with their primary care provider the fact that they're in recovery. And that is challenging for a healthcare provider to know how to best treat a person if they don't know that the person is in recovery. So an annual sort of, hey, how's your recovery going? Can be helpful in thinking about medications that they may need, thinking about, are there any special healthcare needs that you have that we need to be talking about? Healthcare providers can be champions in the community. People listen to their doctors usually, and healthcare providers who are willing to sort of be out there about recovery can be very, very powerful champions in the community. They're looked on as people who are knowledgeable, particularly about this issue of addiction and recovery, and they can show up. They can really show up at different events, different educational events to be supportive. And then connecting people as healthcare providers, connecting people uh, in recovery with people in power at other parts in other parts of the ecosystem. So if you're a physician and you know a legislator, that it can be a tremendously powerful connection to make with a person in recovery who's seeking a policy answer or policy change to some challenges. So purpose, we know it's usually education and employment, although it goes beyond that. It's really what is your why? What is your why? And we can all help figuring that out. So in the workplace, um, I know there are a lot of employers who are stepping up now to be designated as a recovery friendly employer, but you don't have to have a designation to be interested and proactive in educating your staff about recovery, in educating supervisors, for example, and how to create a safe place for people to talk about their needs. Hey, you know what? I'm having a bad day today. I'm not going to be at my best. Uh, something happened at home. Sometimes it doesn't have to be any more than that. And also then employers connecting with other employers in the ecosystem to talk about this issue. So sometimes in some areas, it kind of depends on what the civic organizations are in your area, but Rotary groups or chambers of commerce are sometimes that connecting place around this particular issue, around recovery. What it's like to hire people in recovery, what it's like to reach out to individuals in recovery, what it's like to support family members in the workplace. So some examples that I have run across recovery resource groups, there are some particularly large employers will, well, employees in large employers will form their own resource group to make sure that people in recovery have a place to go, have some support. Supervisors may want to have lunch and learns, start gently talking about, what is addiction? What is recovery? What are the resources in our area? And then how can we be supportive? Supervisor trainings I mentioned, and then resource fairs. So having a group of employers that get together who I would say probably resource fair, but also employment fair, so that people in recovery who are seeking work can be invited to employers that are going to be friendly to employing them. Purpose can also mean advocacy. So many people in recovery who many people in recovery find their purpose in advocacy. This tends to be particularly true of young people, but not exclusively. And so, as allies, we can also become an advocate for whatever the policy issue is. I've got a couple of down here: naloxone laws, local zoning laws, code enforcement. These are all real, live, real world situations changing drug sentencing laws that's going on at the state level in a lot of areas, and funding decisions. So let's not forget about the opioid settlement dollars that have gone to almost every state. There's a lot of money. It's going to be coming for another 15 or 16 years. And being involved in the decision, being involved with people in recovery about the decision about where that money goes is a very strong place for Recovery Allies to act. Faith leaders have a particularly special place as recovery advocates. Of course, they're perhaps limited to their flock of people who come to their organization or church, but they, as people who are looked up to in the community, who are looked up to as compassionate individuals, can be important allies. Now, I know that there are some people who have had very bad experiences, people who, when they were using substances, had pretty bad experiences in the faith community. And so, I'm not advocating that this is the best place for everyone, but for some people it is. And faith leaders can be encouraged to go beyond, like, don't just make your basement available for meetings, but how about educating your congregation about what addiction is? Have people in recovery come and engage and tell their stories, talk about the importance of addressing stigma. I know in one state, part of Kentucky, I think it is, a bunch of churches got together. They realized the problems that they were having in their communities, and they wanted to be a voice of support. And so they just locally had created their recovery friendly church designation so that people who were seeking answers in churches would know, if they were in recovery, they would know that that would be a safe place to go. So in the community, remember we talked about resources in the community as being so important. And so part of that are recovery support services. And so if you are, for example, a fundraiser, or if you're good at communications, or if you're a nonprofit manager, you have that experience, personnel, HR management, there are any number of recovery support services that would love to have your support and would love to have you, perhaps as a volunteer, perhaps as an employee, but looking for places that fit your skill set in the recovery support arena can be very powerful. And then I think especially for professionals who are working closely hand in hand with individuals in recovery, showing up when there are events in the community is just so incredibly important. I hear from so many people in recovery that it's meaningful for them. It means a lot to them when they see an individual that perhaps has provided them some counseling show up, or write letters to the editor. Um, Coaches, for example, can be so incredibly important if they show up at a recovery event. Restaurant owners, law enforcement, pastors and faith leaders, showing up, it's one way to be a champion, speaking out. If you are inclined to be involved in legislative initiatives, if you're a coach, for example, wow, it's so powerful that the voice that you have to support people in recovery. So I'm going to stop there. Here's my contact information. I'll be happy to take some questions, and I would encourage you to contact me. I'd love to have a conversation with anyone. Here's my email, and then further slides, you can look at these when you get the slide deck, have articles and resources and citations for the discussion that we've had. So any questions?
It doesn't look like anything is currently coming in.
Okay.
Um, we can, oh, here's one. Is there a format for a recovery checkup?
That is a great question, and I am not aware of one. So my primary contact in that arena is a physician who's in recovery, and he has introduced that concept to his own primary care provider. So that's a little bit of a different situation because it's really peer-to-peer conversation, even though it's doctor-patient. So I am not aware of one, no. But there's an opportunity there. There's an opportunity to create one.
All right. Well, if you have any last minute questions, oh, here's another one.
Okay. Presentation
Uh,
regarding. I just saw part of it. What did that say?
it would be nice to have a presentation regarding a checklist to discuss with clients' doctors.
Okay, okay, yep. I can see what I can find for resources. That would be great. I'll make a note to myself. And it looks like somebody couldn't get through to recoveryanswers.org.
I'm gonna post the link. It looks like it's working for me right now. Uh, that's the full link if anyone would like to try to go to that. I know I've used the Recovery Research Institute for a lot of things at my job and find it as a very helpful tool. So,
And the people there, if you don't find what you're looking for, they're very open to conversation, email, whatever, phone call, and they can direct you to what's available. And if there isn't anything available, they'll tell you. So they're very approachable.
all right. Well, Allison, thank you for joining us a second time. I'm going to go through our last minute housekeeping items. If anyone has any last minute questions, please get those in. Um, just a second. All right. Thank you everyone for attending today, and thank you for attending last week if you were on um both calls. Just a reminder, we will have recordings from last week and today on our website as well as the slides. I want to remind you of our evaluation and CEU process. You will receive several follow-up, well, you'll receive one follow-up email from us. It will be a link to the evaluation as well as a step-by-step instructions on how to obtain your CEUs. Please note that it will take up to 48 hours for your CEUs to become available because we have to cross-check your attendance records. If you have any issues accessing those, please feel free to email me at marla@ireta.org or info@ireta.org. We would like to request that you fill out our evaluation. It should take no more than 2 minutes of your time. Again, we want to thank everyone for taking time out of your day to participate. And if you have any questions at all, again, please email us. The email address is info@ireta.org, or you can reach me directly at marla@ireta.org. And with that, I would like to thank Allison one more time, and I will conclude the webinar. Thanks so much, everyone.